Patient 3, Rebecca. The first day of her last menstrual period was September 10th, 2021. Today is June 7th, 2022. Calculate her estimated due date and gestational age using Naegele's rule. If you got June 17th, 2022 for the estimated due date, you are correct. Now let's walk through the calculations step by step. We begin with the first day of Rebecca's last menstrual period, which was September 10th, 2021. The first step in Naegele's rule is to subtract 3 months. September becomes June, so September 10th, 2021 becomes June 10th, 2021. The next step is to add 7 days. June 10th plus 7 days gives us June 17th, 2021. The final step is to add 1 year. That gives us an estimated due date of June 17th, 2022. So Rebecca's estimated due date is June 17th, 2022. Now let's calculate the gestational age. Today's date is June 7th, 2022. The estimated due date is June 17th, 2022. That means there are 10 days remaining until the due date. 10 days is equal to 1 week and 3 days. Remember that a full-term pregnancy is calculated as 40 weeks. So if there is 1 week and 3 days remaining until 40 weeks, we subtract that from the total gestational period. 40 weeks minus 1 week and 3 days equals 38 weeks and 4 days. Rebecca's gestational age is therefore 38 weeks and 4 days. At this stage of pregnancy, Rebecca is considered essentially term. This means the baby has reached an appropriate stage of development for delivery. Labor occurring today, tomorrow, or within the next several days would be considered physiologically appropriate. From a pre-hospital obstetric perspective, this changes focus of the assessment. Earlier in pregnancy, providers are often focused on determining gestational age, evaluating viability, and identifying complications. However, once a patient reaches term, the focus shifts toward delivery readiness and identifying signs that labor may be progressing. At this point, the provider should pay close attention to indicators that childbirth could occur soon. This includes assessing contractions, evaluating for rupture of membranes, and identifying vaginal bleeding or discharge. The fetal position also becomes important. Understanding whether the fetus is in a cephalic or breech presentation can affect pre-hospital management and transport decisions. Assessment of fetal heart rate is equally important. A normal fetal heart rate provides reassurance regarding fetal status, while abnormalities may indicate fetal distress. Providers should assess for signs of active labor. This includes contractions becoming stronger, closer together, and more regular over time. The presence of crowning, strong bearing down efforts, or an inability to delay pushing may indicate that delivery is imminent. These assessments become essential because a patient at 38 weeks and 4 days may progress rapidly into active labor. Recognizing these findings early helps providers prepare appropriately for delivery and maintain maternal and fetal care priorities. As you can see, using Naegele's rule to estimate both the due date and the baby's gestational age is relatively straightforward. The calculation itself is simple, but its clinical value is important. Accurately determining gestational age helps providers understand the stage of pregnancy, anticipate complications, guide assessment priorities, and prepare for appropriate obstetric management. In Rebecca's case, calculating the due date and gestational age immediately tells us that the pregnancy is near completion and that labor may occur at any time. For that reason, calculating the estimated due date and gestational age should become a routine part of every obstetric assessment. It is quick, clinically useful, and provides important information that supports safe and effective patient care during pre-hospital obstetric assessment and ongoing patient management.